Hi, I'm Dr. Shu from Animal Medical Hospital. Today we're going to talk about sub-Q fluids. Sub-Q fluids, what are sub-Q fluids? So sub-Q means subcutaneous, sub means under, cutaneous means skin. So for our pets, they actually have a nice pocket right under their nape of their neck, dogs and cats, called the sub-Q space. For our pets, we can do injections there, we can give fluids, we actually even place the microchip, which we'll discuss in another video. So both dogs and cats have sub-Q spaces. Fluids usually are already prepared depending on each patient. They may have their own bag of fluids. So this is a full liter. We're only gonna give her a portion of this. This fluid line's already ready to go, and each pet will have a needle. Each time we always use a new needle. When you're administering the fluids, be careful. Once you remove the cap, you don't wanna poke yourself. If you poke yourself, you do want to change the needle. Try to make sure that this stays sterile. You don't drop this into any dirt. Always try to keep everything capped, alrighty? As we were discussing, we're gonna go ahead and give this injection under the skin. So if you wanna go ahead and hold our little girl right here. When you're giving a subcutaneous injection, you want to make this little tent. You can use your thumb and your third finger. Make a little tent. Use your second finger to create that little space.
Ready, Frankies?
Okay, right there. So if you move it around, you can see that it's not coming out from under the skin. And how do we test this? We'll go ahead and turn on the fluids.
Okay, mommy.
So if you have a partner in crime, one person can hold the needle. You can see our needles being held right in place and just very gentle pressure right there. So if she were to move, we don't accidentally pull the needle out. And then your other person uses gravity or uses force to go ahead and allow the fluid bag to run.
Good job, Mama. Yeah, good birdie.
The other thing that can bother your pet when they're receiving subcutaneous fluids is the temperature. So as you saw, this is at room temperature. You don't want to microwave the fluids. How you can do it is you can put it in a warm bath before administering it, or you can keep it underneath your arm so it can warm to your body temperature. But you do not want to microwave the bag. As the fluids are being administered, you can see there's a small lump that's forming under the skin. You can show that. As they soak up their fluids, the fluids will migrate to underneath the armpit to create a little bubble. As our pets are getting their subcutaneous fluids, usually this is a pretty relaxed, low stress treatment. Giving them praise, giving them pets, treats always helps. Perfect.
Oh, hold on, Mama.
Once we're done, we'll go ahead and remove the needle and then again, cap the needle. If you're comfortable, you can cap it directly on top. If you're uncomfortable with that, go ahead and put your cap on the table and then insert it in that way. Then when you're ready for your next administration, you do want to go ahead and twist this off and put a new needle on it. Every time you inject your pet, you should always be using a new needle. Remember, after subcutaneous fluids, they might be a little bit moist at the injection site. If there's a little dribble from the injection site, just go ahead and put pressure on it. You can put a towel, a small cloth. The pressure will stop. And over the next several hours, that fluid bubble will then migrate to under the arms. Don't be alarmed if you start feeling a little bit of jello, okay? A little bit of jiggle where the fluids will go. Good job, little one. All done. That's it.